As GLP-1 medications continue to get more popular, questions are being raised about the way they're being prescribed. A new Daily Mail op-ed warns that you can get them without a face-to-face meeting with the doctor. So is the convenience a health risk? Here to react is obesity medicine specialist and the founder of SoWell, Dr. Alexandra Sowa. She joins us now. Doctor, so great to have you on.
Thank you.
So you are a weight loss
Yes,
doctor.
I've been doing it for a long time, over 10 years before anyone else was talking about it.
The number is astounding.
Yes.
1 in 8 Americans are on, Wegovy or Ozempic, one of these GLP-1 drugs. Why are they so popular?
Unfortunately, we have a chronic disease problem in this country, and a majority of it stems from excess weight. And so a lot of people are affected by obesity. In fact, around 50% of the country or more qualifies for these drugs based on the FDA indications.
So before we talk about whether people should be seeing a doctor in person or not, let's talk really quickly about this. The studies, the studies that were done on these drugs, the rats got thyroid cancer, and you know that we're never getting to the root cause, which is really the ultra-processed food and lack of exercise.
Well,
so what do you say to that? Well,
these drugs do actually help us get to the root cause. They prevent a lot of the chronic disease that comes down the pipeline, heart disease, type 2 diabetes. Yes. And it allows us to give pause and actually change our eating behaviors and our families and our communities. I have great hope that these drugs will actually allow us to back it up and get to the root cause. And in terms of side effects, these drugs aren't new. We've had them out in human use for well over 20 years now. And anything hypothetical we might have seen in rat trials has not actually extended into humans. And in fact, we see decreased rates of cancer across the board on these drugs.
So the side effects are losing your hair, losing muscle loss. So what do you think about people getting these drugs without even seeing a doctor like you?
Well, I think we have an access problem in this country, and less than 5% of people who qualify for weight loss medications are ever offered them. And telehealth can be a great platform to open up access. The problem is these are drugs that are really intended to be used lifelong. And so if it's so easy to get it without anyone having a fully informed discussion with you, this could be a vehicle just yo-yo dieting all over again like the 1990s, just with better drugs. And I do worry about that.
You're saying you shouldn't get on one of these drugs, then you lose the weight and you get off. The pharmaceutical companies say you need to be on it for life.
Well, and that's what the studies show. So we just had another big comprehensive study come out this week that showed when you stop, all of the weight comes back within 2 years and all the health benefits melt away.
Doctor, this is what I'm talking about. It's not getting to the root cause, which is the food and the eating and the ultra-processed food, which our own government needs to deal with that stuff. Okay, let's talk about another trend that's happening, and that is that people are using ChatGPT to get their information. So let's say I have some sort of thing going on in my body. I ChatGPT it, or I take a picture of the rash I have on my arm or something, and then it tells me what it is. Again, are you worried that ChatGPT is I'm going to self-diagnose and not go to an actual doctor? And are you concerned about that?
Well, I think that's been happening for a long time, right? Dr. Google.
Yeah.
But again, we have an access problem in the country. I think people being more informed about their own care and actually connecting the dots even before they go into the doctor is a wonderful thing. I actually just had a patient this week who uploaded a picture of a rash, put it in, said the symptoms. ChatGPT appropriately said, you have early shingles. And luckily, she had a primary care doctor to get into same day. A lot of people don't. So I worry, okay, great, we have all this information, and then what?
Yeah, can you get to the doctor? That's why I'm a huge fan of telehealth. I think it's fabulous.
Yes.
I know there's a lot of people that don't like it, but I think that access is important.
Exactly.
So it's a balance. Great conversation. Dr. Alexandra Sowa, she is a weight loss doctor, and you can check in with her. Thanks so much.
Thank
You got it.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.